Hello everyone, this is our presentation on herpes simplex virus 1. Today we are going to be covering the etiology, reservoir, signs and symptoms, treatment, prevention, and other interesting facts. Herpes simplex virus, or HSV infections, are very common worldwide. As mentioned in the name, herpes simplex virus is a virus. HSV-1 is the main cause of herpes infections of the mouth and lips, including cold sores, fever blisters, which are ubiquitous and contagious. The etiology of herpes simplex virus is herpes simplex virus 1, also known as human herpes virus 1, is one of the two members of the herpes virus family that infects humans. They can be spread when an infected person is producing and shedding the virus. Herpes simplex virus 1 is a double-stranded DNA encased with an envelope. It also has at least 74 genes. Moving on to the reservoir of herpes simplex virus. HSV-1 is carried by humans and passed through contact between them. This can be spread through contact with saliva, such as sharing drinks and kissing. HSV-1 moves into neural ganglia after initial infection, usually the trigeminal ganglia. As shown in the figure on the slide, using latency-associated transcript, the virus regulates the host cell genome and interferes with the natural cell death mechanism, therefore preserving a reservoir. The herpes virus can lie dormant in the neural ganglia indefinitely or surface in recurrent infections known as outbreaks. Individuals who are infected with the herpes virus may not know that they are infected. This is because it can take months or years for symptoms to occur, and even when symptoms do occur, individuals may not know that they are caused by herpes. There are multiple potential triggers for herpes. Outbreaks can be triggered by illness, emotional and physical stress, fatigue or injury, menstruation, exposure to bright sunlight, and diet. Stress most often is mental, but can also be physical stress, as explained. Could be exposure to bright sunlight, can be a factor as well. Stress changes our body's internal chemistry, and these changes often affect how our immune system functions. When we're under stress, our body produces more hormones such as adrenaline and cortisol. Both of these hormones, when constantly called upon as a stress response, have been proven to suppress our immunity. Moving on to fatigue. Sleep is required for our body to release potent immune-enhancing hormones into the bloodstream. These hormones are vital in completing the body's nightly restorative process. By skipping out on sleep, you are weakening the body's immunity and its ability to defend against viral and bacterial invaders. Lastly, diet. People with herpes also need to pay attention to what they're eating, because a lot of foods have high amounts of amino acid with arginine. Arginine, like lysine, is one of the 8 important amino acids found in foods. Foods such as peanuts, raisins, chocolates, some grains, and wheat have twice as much arginine than lysine. Too much arginine can trigger an outbreak because the herpes virus needs arginine in order to grow and multiply.
Hi, my name is Laura. I'm going to be telling you about the symptoms, signs, and transmission that are associated with the herpes simplex 1 virus. I am actually speaking from firsthand experience, as I am a carrier of the virus. So everything I'm going to be talking about, I have experienced personally. During the initial primary infection, when the virus first enters the body, many people will experience high fever, muscle aches, swollen lymph nodes, and other flu-like symptoms. During the subsequent outbreaks, usually a day in advance, carriers will experience a tingle, an itch. Some people describe it as a burning sensation at the site where the virus is going to be surfacing, as you can see in this picture here. So the site that it does surface is usually on the mouth or near the mouth. It can be inside the mouth. though it can also come up on anywhere on the skin of the body, though it's less common. The sores are known as cold sores or fever blisters. They're kind of the infamous hallmark of the herpes virus. And as you can see in this picture here, they are made up of these little fluid-filled blisters. And the fluid inside the blister starts to weep or leak after about 3 or 4 days of the blister being present. And about 4 days after this, the sore will begin to heal with a crusty scab that's usually yellow or kind of a darker pigmentation. So there are some carriers of the herpes simplex 1 virus who actually don't experience any signs or symptoms at all. The viral shedding still occurs, but without any visible signs. It's known as asymptomatic shedding. So there is still a risk of transmission during this time, and no one really knows when the shedding is happening because there's no symptoms of it. But the risk of transmitting the virus during this is estimated to be lower than 1%. So it can happen, but it doesn't happen very frequently. Usually the virus is shed and is passed to other hosts and infects other hosts while there is a fever blister present. The virus can be passed from the fluid that's inside of the blister, which is very contagious, or it can also be found in just other bodily fluids of the host, such as saliva. So even things that don't come in contact with the fluid of the blister can still be contagious. So this makes the common ways of transmission to be skin-to-skin contact, such as kissing, or sharing items that have come in contact with the site, such as lip balm, eating utensils, drinking from the same cup, using the same towel, or other such things. And the virus will enter a new host through broken skin or a mucous membrane, such as inside of the mouth. It can also be passed in through the eye, and if you get a cold sore or a virus sore on the eye, it can potentially leave scarring, can affect vision, or even cause blindness. It can also enter, if it comes in contact with the genitals, it becomes herpes simplex virus 2, which is commonly known as genital herpes. As you can see here, there's a statistic from the National Institutes of Health that estimates that by the age of 50, approximately 90% of adults have been exposed to the herpes simplex 1 virus. So this doesn't necessarily mean that these people have become infected with the virus, but just that they have been exposed, similar to if you are exposed to a cold, you might not get it, but you have been around it. The statistics for carriers, though, are equally shocking. So you can see in this graph here, the orange represents people who are infected. So 62% of adolescents are already carriers of the herpes simplex 1 virus. And by the time that adults reach the age of 60, it's estimated that anywhere as high as 85% have become infected with the herpes simplex 1 virus. So it truly is ubiquitous. But here to tell us a bit more about prevention and treatment for the herpes simplex 1 virus, we have Jaron.
Hi everyone, my name is Jaron Clyde. I will be talking about the treatment, prevention, and additional information about herpes simplex 1. So currently there are no vaccines for herpes simplex 1. Researchers have been laboring for years to come up with herpes simplex virus vaccines, but we don't have any yet. A very important part of managing the herpes simplex virus is recognizing it and treating it early. It can be recognized by the signs and symptoms previously discussed by the other members of my group. Both primary and reactivated infections with herpes simplex 1 are treated with the same specific antivirals, but the chronicity determines the dosage and also the frequency that the dosage is given. Initial infections are treated with higher dosages and more intense frequencies. Episodic therapy for herpes simplex 1 infection includes antivirals at higher doses, usually multiple times per day. It can also include topical viral suppressants like, and I don't know if I'm saying this right, docosanol cream, also known as Abreva, applied 5 times per day for up to 10 days. I also read about the amino acid lysine being used to inhibit the replication of HSV-1, although I wasn't able to determine if that's a recommended treatment. Suppressive therapy for the disease includes lower dosages of antivirals once or twice per day. The whole goal of these drug treatments is to prevent morbidity and other complications of the disease. Hopefully in the future we will be able to destroy the virus instead of just treating it and suppressing it temporarily. The side effects of these antivirals with acyclovir, for example, a common antiviral therapy, this treatment is hard on kidneys. It may also cause malaise, nausea, headache, diarrhea, or vomiting. There are also other rare but serious side effects. So general care for the wound. Adequate hydration is important during treatment, especially during antiviral therapy. General wound care should be maintained to avoid the risk of secondary bacterial infections. Keeping the wound from drying out can prevent cracking and splitting, which is painful and can increase the chance of secondary infection. Keeping the wound clean with soap and water will help this as well. Anesthetic gels, non-steroidal anti-inflammatory drugs, and Tylenol can be given to treat pain. Home remedies include ice packs and baking soda to soothe the pain. For prevention, it's important to avoid sharing toothbrushes, drinks, food, kisses, towels, and other things through which the virus can be passed with people who have the cold sore, who have this virus. Now, obviously, we can't avoid all these things all the time, but if someone has an active sore, we can do our best to avoid sharing a drink or something of that nature with them. Additional information, epidemiology, rates of HSV-1 infection for low socioeconomic areas are 70 to 80%, while they are 40 to 60% in higher socioeconomic areas. 57.7% of the population of the United States is infected with HSV-1, although the majority of them are asymptomatic. This is an interesting little bit. Duke University is taking a different approach to HSV. They said unless you can activate the virus, you can't kill it. So they are working on overriding the microRNA that keeps the virus in its latent state, and in theory you could activate all the virus at once, and once it's alive you could kill all of it for good. The person would have to have one last terrible cold sore, but then that would be the end of their cold sores.
Hi again. As I said during my presentation, I am a carrier of the herpes simplex virus 1, but a few years after I contracted the virus, I actually unwittingly passed it on to my mom, and she got the virus off of a cup I'd been drinking out of. She drank out of the same cup, and she got very sick. However, after her primary infection, she doesn't have regular outbreaks. So it's interesting how even the same genetics, the virus can affect differently. So I have outbreaks, my mom doesn't. But living with herpes simplex 1, I definitely have to monitor how I act and how I live to make sure that I'm not passing the virus on to people around me.